Hi dear doctors, welcome to the class of Kidscovery. Myself Dr. Parv and you are sitting with me doing the Pediatric Orthopedics. So starting with the Pediatric Orthopedics lecture, that is Subluxation of Radial Head. Okay, so during our childhood days we all must be having this memory, we used to grab the hold of the fist of the child and we used to rotate it like this. Okay, so this was done by most of the nurses also. Okay, so that's why this condition is called as nursemaid's elbow. So what happens actually, see, whenever you try and pull the elbow of the child, right? So there is an injury which happens at the ligament. So can you see, this is a normal elbow, this is a normal thing. So what is this? This is an injury to the ligament, and that's why, because this injury is happening, there will be a radius which is slipped, and this slippage of radius is called as radial head subluxation. Radial head subluxation. So nursemaid's elbow or radial head subluxation, okay, these are the same things. So what happens? There is subluxation of radial head due to the displacement of the annular ligament into the radiohumeral joint. So what is happening? See, the ligament is getting torn. Okay, so the ligament is getting torn, and since the ligament is getting torn, what is happening? Which ligament? Annular ligament. It is getting torn. So there is displacement of the radial head, and the radial head is going to get displaced, and it's going to get merged, or it's going to get into the radiohumeral joint. What happens? When does it happen? I've told you, during our childhood, like 1 to 4 years. Okay, toddlers in that. So what happens whenever you give the axial traction on pronation of the forearm? Okay, whenever you give axial traction on pronation, okay, so on pronated, okay, so if the arm is actually pronated and you pull, okay, so what is going to happen? There will be a damage to the annular ligament, and when it is damaged, it is going to have the subluxation of the radial head. Okay, so what is happening? Whenever we are applying the traction on the distal radius, the radial head is going to slip out of the annular ligament. Okay, and then what happens? That the whenever we are from the traffic, sometimes I've seen the females pulling the child. Oh, come, or from the from traffic, from stairs also, you just pull like that, or just playing around the child. Okay, so what happens now? The child is going to have an extended arm. The child is going to have what kind of arm? Extended arm or slightly flexed arm. The forearm will be pronated. Okay, and the child will have pain. Okay, child is going to have pain. The child will not do anything because it is paining. So sometimes mother says, sir, see my child, I think it's a paralysis. I'll say, no, it's not paralysis, it's just the pain. Just the pain is there, that's why the child is not moving the limb. So child will have an extended arm, the child will have a pronation of the forearm, there will be pain, there will be refusal to use the limb, that is called as pseudo paralysis. But yeah, because it is not a fracture, there is no swelling, there is no deformity which is going to be there. Okay, so X-ray is actually not done if there is no edema and there is no deformity, because X-rays are done when we suspect the fractures. So what is the treatment? Treatment is actually pronate the forearm. Okay, and you have to pronate the forearm and you apply the pressure on the radial hand so that it get fit again. Okay, so hyperpronation method, that is pronate the forearm while applying pressure to the radial head. Okay, and there is another method which is called as supination flexion. So you supinate the forearm and flex the elbow at 90 degree. Okay, supinate the forearm and you are going to press the elbow or flex the elbow to 90 degree. A palpable click or a palpable clunk sound will indicate the reduction. Okay, fine. So this is it about the topic which is asked mostly in the vivas, and that's true in orthopedics, but then still it has got a connection with the pediatrics. I'm going to teach you and I've taught you. So thank you so much for joining. We'll see you in the next class.